going to be performing a insertion of a Foley catheter today, and also doing a removing Foley catheter procedure. Prior to the procedure, I would ID the patient, review the medical record, review the order. I would assess my patient for her mobility, her level of consciousness. I would also ask her about her previous experience with Foley catheters, and how did that go? Did she have pain? And I would also go ahead and discuss the procedure with the patient. I would wash my hands, provide privacy, and then I would begin to palpate the patient's bladder, feel for any pain maybe that the patient has. And then I would also identify the patient with two identifiers, like I said previously, but I would verify that this is a female patient, she is 30 years old. I would check her previous intake and output, and I would inform her the reason why she's getting a Foley catheter today, and then I would go into a little more depth about explaining the procedure. And lastly, like I said, I already washed my hands. I would put on clean gloves, and I would clean the patient's perineum area with a mild soap and water that they provide, and with a basin, and I would clean the area and make sure they're dry prior to preparing my sterile field and doing the procedure. A lot of patients that are immobile aren't able to clean their perineum themselves, so providing that care for them can really decrease infection when doing the Foley catheter. So I'm going to go ahead and start. This is Mrs. Smith, and I've introduced myself. I've told her my name is Alyssa. I am her student nurse today, and I went ahead and I brought the patient's bed to my height when I was cleaning the perineum. I've laid the patient flat. She's in lithotomy position, and she said she doesn't have any pain. I've explained to her this might be a little bit of discomfort. She might feel some pain slightly after the procedure, but it should just be short-lived and go away. Having pain with a Foley catheter is not normal long-term wise. So I would go ahead and drape my patient. I'm pretending this is a sheet. I would also put a waterproof barrier under this patient, just in case we don't get the bed wet. And so I would go here, and then I would go ahead and discard my my previous gloves that I was using, and I would wash my hands again, and then I would go ahead and start opening my sterile field. Mrs. Smith, I'm going to go ahead and start the process, this procedure process. I'm going to open my sterile field. Here I have my sterile Foley catheter kit. I'm going to use this bag as a trash, and I'm going to go ahead and open this sterile field away from me. And always remember to keep it away from the, try and keep your supplies away from the 1-inch border. And first, I'm going to go ahead and put on my sterile gloves. It's the first thing I should do. I have my sterile gloves on, so now that my sterile gloves are on, I'm going to go ahead and drape my patient. So I would take this drape first, and I would go ahead and hold it here. Ms. Smith, I'm just going to put this underneath you. then I would go ahead and drape the perineum. Here I would expose the urethral opening. Okay, Miss Smith, I'm gonna go ahead and prepare my supplies, okay? You let me know if you need anything. Here I'm gonna open up my betadine. I would place it here on the tray. I'm gonna go ahead and make this like so. I have my jelly, I'm gonna pour it here. I'm gonna prepare my syringe. It has 10 cc's. I'm letting the air out. I'm gonna go ahead and open my specimen cup just in case I were to need to collect a specimen at this time. Going to take off my catheter sheath. And I'm gonna place it just in the jelly until I get prepared to use it. And then I'm also gonna go ahead and connect the syringe. Fan is going in my room, so my sterile field is waving around. Okay, so from here I am gonna start, I'll have a dirty hand from this point forward. I'm going to expose the patient's urethral meatus because I need to clean it, so I'm gonna take my clean hand and go ahead and grab my betadine swabs and clean one swipe down, discard it, two, discard it, discard it. Sorry, throw that away. And then from here is when I would start the insertion of the Foley catheter. Okay, Mrs. Smith, I'm going to go ahead and insert my catheter. When I do that, I will coil this around my hand, bring it into my sterile field. It has lubricant on it. Okay, Mrs. Smith, would you mind bearing down as I insert your catheter? And I would advance the catheter until I see urine output in the line and I see urine. Now I'm going to use this hand to secure the catheter. My dirty hand is securing the Foley, and I'm going to go ahead and inflate the balloon. And my syringe, I'm throwing that away. And now I'm going to go ahead and give this a little tug. And I'm feeling resistance. I know that the Foley's in place. And I'm going to go ahead and secure the line to, this is a female patient, so I'm going to secure it to her upper thigh, mid-thigh. And then I'm going to put the bag to a immovable part of the bed. We want to make sure it's not attached to anything where it can get pulled. And then I will go ahead and collect my supplies, and I will discard my items, pretending that's the trash, and let's pretend like I took this drape off as well, and it's all discarded. I've taken my towels, and the patient's all cleaned up. And if the patient had betadine on her still, I would have cleaned it off prior. I'm seeing good urine output. I'm noting the characteristics of the urine. Do you have any pain, Mrs. Smith? I'm going to go back to palpate the bladder to feel if it's in place and if she has any pain. Okay, great, it's looking good. I see that the catheter is not being pinched. And I'm going to dispose of my gloves and wash my hands again. And I'm going to also reposition the patient, re-raise her side rails. I had lowered her side rail before and kept the other one up just in case, so she doesn't roll out. But I raised her side wall back up, put her bed, lowered it back down into the correct position, and then I've also raised the patient back up. I'm going to explain to my patient, Mrs. Smith, just so you know, your catheter bag should always stay below your waist. That way no backflow gets into the bladder, and also it's draining appropriately and the urine is coming out of your bladder appropriately. Also make sure if you sit up on the side of the bed, your catheter does not get pinched, because that could occlude it and make it so urine doesn't flow out. And I will go ahead and check on you in a few hours, and I will come and check on you. Here's your call light. If you need me, call me before. If you need me before I come in, just go ahead and hit your call light, and I will check on you. So now that I leave the room, I'm going to document the urine output, and I'm also going to follow up. Per doctor's orders, I'm going to note in my documentation the French. This patient has a 14 French catheter. I'm going to note in my documentation the number of cc's, which is 10 that I inflated the balloon with. And I'm going to note the patient's characteristics after I inserted the catheter. Does she have any pain, etc.? And that is my insertion for a Foley catheter. Now I'm going to remove this patient's Foley catheter. I would go about it the same way. I would assess the patient, get her two identifiers, her name, her date of birth. This is a female, and I would assess her level of consciousness. I would assess her mobility. Does she have any pain right now? I would also look at the urethra to make sure it hasn't had any trauma. I would monitor for signs of UTI. I would tell her, explain the procedure. Mrs. Smith, I'm going to be removing your catheter today. This should be you shouldn't feel any pain during this procedure. Maybe mild discomfort, but really, usually when removing the catheter, there is no pain or discomfort. But that's what I'm going to do today. Ask my patient, does she have any questions? I would also assess her bladder, palpate, does she have any pain? And also document, before I remove it, what urine output she has in the bag. So now I'm going to come in. I'm going to wash my hands as I assess the patient prior to removing the catheter. I'm also going to provide catheter care. I'm going to clean the catheter, clean the perineum. I would do that with, like I said, hand hygiene. I would wear clean gloves when doing that. I would discard, and then I would go ahead and put new gloves on after cleaning the patient, and I would remove her catheter. Mrs. Smith, I'm going to go ahead and put this waterproof pad underneath you while we remove your catheter. Let me put this here. And again, this drape wouldn't normally be there. Okay. And I'm going to go ahead and, like I said, my hands are clean, and I'm going to put clean gloves on. And I would have a clean syringe, and I would previously, before I would even start coming into the room, I would verify again, just in case I wasn't the person who did the catheter. I would verify the amount of cc's in the balloon. And in this case, this patient has had 10. So what I'm going to do is examine the perineal area, like I said. I'm going to insert the syringe. I'm going to pull back on the plunger. I'm holding my hand here at the catheter. Okay. I'll pull 10 cc's out. And I'm going to remove the catheter. Go ahead, take a deep breath for me. Great, I just removed your catheter. I would discard this. I would take the supplies, and I would wrap it up in my waterproof pad and discard it. And I would remove any of the Foley catheter supplies from my table, and I would at this time also re-examine the Foley cath site to see if I missed anything, or once I removed it, there was any trauma to the area. I would again palpate the bladder, ask Ms. Smith, do you have any pain? And then at this time, I would let her know that there's a hat in her toilet, and to catch her urine when she does get up to void. I would say I would come back in about 30 minutes to try and see if she needs to void, but honestly within 2 hours I would want her to be able to void on her own. And I would let her know that I would raise her bed back down, or I would move her bed back down, and then I would raise her back up to whatever comfortable position she was in. And I would say, thank you, Miss Smith. Do you have any questions for me? If she says no, then I would be able to step out of the room. My gloves would be off now, and I would wash my hands again, and then I would go ahead and do my documentation, my urine output, patient outcome, you know, how's she doing after the Foley catheter, is she able to void, and things like that. And that was my Foley catheter care and removal. Thank you.